Proper blood flow and circulation play a vital role in our overall health and well-being. Our cardiovascular system is responsible for transporting oxygen, nutrients, and essential compounds throughout the body, while also removing waste products. When our blood flow is compromised, it can lead to a host of issues, particularly in our extremities like our legs and feet. Maintaining healthy circulation is crucial for several reasons. First and foremost, it ensures that our cells receive the necessary oxygen and nutrients they need to function properly. This is especially important for our legs and feet, which are located furthest from the heart and often bear the brunt of our daily activities. Additionally, good circulation helps to regulate body temperature, support wound healing, and prevent the buildup of fluid in our tissues. When blood flow is restricted, it can lead to swelling, discoloration, and even the formation of blood clots, which can be potentially life-threatening. Common causes of poor blood flow and circulation in legs and feet. There are several factors that can contribute to poor blood flow and circulation in our legs and feet. Some of the most common causes include sedentary lifestyle. Lack of physical activity can lead to sluggish circulation, as our muscles are not being adequately engaged to help pump blood throughout the body. Obesity. Excess weight can put additional strain on our cardiovascular system, making it harder for blood to circulate efficiently. Diabetes. This chronic condition can damage blood vessels and nerves, leading to poor circulation, especially in the extremities. Peripheral artery disease, PAD. This condition occurs when the arteries that carry blood to the legs and feet become narrowed or blocked, restricting blood flow. Deep vein thrombosis, DVT. Blood clots that form in the deep veins of the legs can impede circulation and potentially lead to life-threatening complications. Varicose veins. These swollen, twisted veins can impair blood flow and cause discomfort in the legs. Smoking. The chemicals in cigarette smoke can damage blood vessels and restrict circulation. The benefits of improved blood flow and circulation. Maintaining healthy blood flow and circulation in our legs and feet offers numerous benefits, including reduced risk of complications. Good circulation can help prevent conditions like PAD, DVT, and other circulation-related issues. Improved wound healing. Adequate blood flow is essential for delivering oxygen and nutrients to wounds, promoting faster healing. Increased energy levels. When our cells receive the necessary oxygen and nutrients, we experience higher energy levels and reduced fatigue. Better temperature regulation. Proper circulation helps to regulate body temperature, preventing extremities from feeling excessively cold or hot. Reduced swelling and discomfort. Improved circulation can alleviate swelling, cramping, and discomfort in the legs and feet. Enhanced athletic performance. Athletes and active individuals rely on good circulation to deliver oxygen and nutrients to their muscles, supporting endurance and recovery. Simple exercises to increase blood flow and circulation in legs and feet. Incorporating simple exercises into our daily routine can significantly improve blood flow and circulation in our legs and feet. Here are some effective exercises to try. Calf raises. Stand with your feet shoulder-width apart and raise up onto your toes, lifting your heels off the ground. Hold for a few seconds, then lower back down. Repeat 10-15 times. Leg lifts. Lie on your back with one leg straight and the other bent at the knee. Lift the straight leg a few inches off the ground and hold for a few seconds before lowering it back down. Alternate legs and repeat 10-15 times on each side. Ankle circles. Sit or stand with your legs extended in front of you. Rotate your ankles in a circular motion, first clockwise, then counterclockwise. Repeat 10-15 times on each ankle. Heel-toe walk. Walk by placing your heel on the ground first, then rolling onto the ball of your foot. This engages the calf muscles and promotes better circulation. Leg swings. Stand with your feet shoulder-width apart and swing one leg forward and backward, keeping it straight. Repeat 10-15 times on each leg. Stair climbing. Climbing stairs is an excellent way to engage the muscles in your legs and improve circulation. Remember to start slowly and gradually increase the intensity and duration of these exercises as your body adapts. It's also important to listen to your body and avoid any exercises that cause pain or discomfort. Lifestyle changes to promote better blood flow and circulation. In addition to incorporating simple exercises, making certain lifestyle changes can also contribute to improved blood flow and circulation in your legs and feet. Here are some recommendations. Maintain a healthy weight. Carrying excess weight can put additional strain on your cardiovascular system, making it harder for blood to circulate efficiently. Aim to maintain a healthy body mass index, BMI, through a balanced diet and regular exercise. Quit smoking. The chemicals in cigarette smoke can damage blood vessels and restrict circulation. Quitting smoking is one of the best things you can do for your overall cardiovascular health. Stay hydrated. Drinking plenty of water can help thin your blood and promote better circulation. Aim to consume at least 8 glasses of water per day. Manage stress. Chronic stress can contribute to various health issues, including poor circulation. Incorporate stress-reducing activities like meditation, yoga, or deep breathing exercises into your daily routine. Wear compression socks or stockings. These garments can help improve circulation in your legs and feet by applying gentle pressure and preventing blood from pooling. Elevate your legs. When possible, elevate your legs above the level of your heart to promote better blood flow and reduce swelling. Massage your legs and feet. Gentle massage can help stimulate circulation and alleviate discomfort in your legs and feet. Natural remedies and supplements for improved blood flow and circulation. In addition to lifestyle changes and exercises, there are several natural remedies and supplements that may help improve blood flow and circulation. However, it's important to consult with a healthcare professional before incorporating any new supplements into your routine, as they can interact with medications or have potential side effects. Ginkgo biloba. This herb is believed to help improve circulation by dilating blood vessels and increasing blood flow. Horse chestnut. Extracts from the horse chestnut plant may help strengthen blood vessel walls and reduce inflammation, potentially improving circulation. Cayenne pepper. This spicy ingredient contains capsaicin, which can help dilate blood vessels and increase blood flow. Garlic. Known for its cardiovascular benefits, garlic may help improve circulation by thinning the blood and reducing inflammation. Omega-3 fatty acids. Found in foods like fatty fish, walnuts, and flax seeds, omega-3s can help reduce inflammation and improve blood flow. Turmeric. This vibrant spice contains curcumin, a powerful anti-inflammatory compound that may help improve circulation. Remember, while these natural remedies and supplements may offer potential benefits, they should not be used as a substitute for medical treatment or professional advice. The role of diet in maintaining healthy blood flow and circulation. Our diet plays a significant role in supporting healthy blood flow and circulation. Incorporating certain nutrients and foods into our meals can help keep our cardiovascular system functioning optimally. Here are some dietary recommendations. Increase your intake of fruits and vegetables. These nutrient-dense foods are rich in antioxidants, vitamins, and minerals that can help promote healthy blood vessels and circulation. Choose whole grains. Whole grains like oats, quinoa, and brown rice provide fiber, which can help regulate blood sugar levels and reduce inflammation, both of which can impact circulation. Incorporate lean proteins. Lean proteins like fish, poultry, and legumes can provide essential amino acids that support the repair and maintenance of blood vessels. Consume healthy fats. Monounsaturated and polyunsaturated fats, found in avocados, nuts, and fatty fish, can help improve blood lipid profiles and reduce inflammation, supporting better circulation. Stay hydrated. Drinking plenty of water can help thin your blood and improve its flow throughout your body. Limit processed and high-sodium foods. Processed and high-sodium foods can contribute to inflammation and increase the risk of high blood pressure, both of which can negatively impact circulation. By making mindful dietary choices and incorporating nutrient-rich foods, you can support your body's ability to maintain healthy blood flow and circulation. When to seek medical help for poor blood flow and circulation. While incorporating lifestyle changes, exercises, and natural remedies can help improve blood flow and circulation, there are certain instances when seeking medical attention is crucial. Here are some signs and symptoms that may indicate a more serious underlying condition. Persistent leg pain or cramping. If you experience persistent leg pain or cramping, especially during physical activity, it could be a sign of peripheral artery disease, PAD, or another circulatory issue. Numbness or tingling in the legs or feet. These sensations can indicate nerve damage or poor circulation and should be evaluated by a healthcare professional. Discoloration or temperature changes in the legs or feet. If your legs or feet appear discolored, bluish or reddish, or feel significantly colder or warmer than other parts of your body, it could be a sign of poor circulation. Non-healing wounds or sores. Inadequate blood flow can impair wound healing, so any non-healing wounds or sores, especially on the legs or feet, should be examined by a doctor. Varicose veins or swelling. While varicose veins and swelling can be common, they can also be signs of more serious circulatory issues and should be evaluated if they persist or cause discomfort. Family history of circulatory issues. If you have a family history of conditions like PAD, DVT, or other circulatory problems, it's important to discuss this with your healthcare provider and undergo regular screenings. Remember, early detection and treatment of circulatory issues can help prevent more serious complications and improve your overall health and quality of life. Preventing blood clots and other complications related to poor circulation. Poor circulation can increase the risk of developing potentially life-threatening conditions, such as blood clots and other complications. To help prevent these issues, it's important to take proactive measures. Stay active. Regular physical activity can help improve circulation and prevent blood from pooling in the veins, reducing the risk of clot formation. Maintain a healthy weight. Excess weight can put additional strain on your cardiovascular system and increase the risk of complications related to poor circulation. Quit smoking. Smoking can damage blood vessels and increase the risk of blood clots and other circulatory issues. Stay hydrated. Adequate hydration can help thin your blood and improve its flow, reducing the risk of clot formation. Wear compression stockings. For individuals at risk of blood clots or with poor circulation, wearing compression stockings can help improve blood flow and prevent pooling in the legs and feet. Consider anticoagulant medication. In some cases, your healthcare provider may recommend anticoagulant medication to help prevent blood clots if you are at high risk. By taking these preventive measures and maintaining a healthy lifestyle, you can reduce your risk of developing complications related to poor circulation and promote overall cardiovascular health. Conclusion: taking control of your leg and foot health. Maintaining healthy blood flow and circulation in your legs and feet is crucial for overall well-being and preventing potential complications. By incorporating simple exercises, making lifestyle changes, and considering natural remedies and dietary modifications, you can take an active role in improving your circulation. Remember, while these strategies can be highly beneficial, it's essential to consult with a healthcare professional if you experience persistent symptoms or have concerns about your circulatory health. Early detection and treatment of any underlying conditions can help prevent more serious complications and ensure you maintain optimal leg and foot health. If you're ready to take control of your leg and foot health, start by incorporating the simple exercises and lifestyle changes outlined in this video. Take the first step towards improved circulation and overall well-being today. For personalized guidance and support, consider consulting with a healthcare professional or a certified fitness trainer who can tailor a program specifically to your needs and goals. By prioritizing your circulation and taking proactive measures, you can enjoy the numerous benefits of improved blood flow, including increased energy, better wound healing, and reduced risk of complications. Embrace a holistic approach to your leg and foot health, and experience the transformative power of improved circulation.